Welcome to Quarateg's Not Just for Boys initiative, which we have recently moved online, providing 1 hour webinars for girls who are interested in careers within STEM, which includes science, technology, engineering and maths. Our Not Just for Boys initiative is usually run during live events, which some of you may have attended in the past. They take place in an employer's place of work, and they provide the girls with a day in a life experience of what it's like to work there, showcasing rewarding careers in STEM. These events usually feature female role models and have lots of try-a-trade activities for you to have a go at. However, during these challenging times, we've decided to move these online for the time being. These webinars are a fun and interactive way of helping to keep you inspired and motivated while showcasing rewarding careers within STEM. They're not just for the boys, and ensuring that your career choices are not limited because of your gender. Today's Not Just for Boys session is being delivered in partnership with the Association of the British Pharmaceuticals Industry, and we'll shortly be hearing from 4 inspirational women that all have really interesting careers there. They will be sharing their career journeys with us, the challenges that they face and how they've overcome them, and what they find most rewarding about their careers. And we hope that you will be inspired by their career journeys and decide to take the leap into STEM yourselves. During the career talks, if you have any questions that you would like to ask the speakers, then you can do so using the question facility in the webinar toolbar, and we'll ask these questions at the end as well. So have a think whilst you're listening to the speakers today. I will be your host. I'm Emma Tamplin. I'm from Quarateg, and I manage a number of great projects, networks and events such as the Not Just for Boys initiative, which supports girls to reach their full potential. I also work closely with women and with businesses in Wales to help them create flexible and inclusive workplaces that support the development and progression of women. Quarateg. So who are we? Quarateg is a leading gender equality charity here in Wales, working to ensure that women can enter the workplace, develop their skills and build rewarding careers. We have a vision of a Wales where every woman and girl is treated equally and is fully able to participate and be represented in the economy, in public and political life, and live safe from violence and fear. So before we get started, I just want to ask you a quick few questions, just so we can get to know you a bit better. So bear with me. I'm going to load 3 questions up, so if you could answer those questions using the toolbar. So the first one, we just want to find out where you are today. So which region of Wales are you from? Okay, so you've got a bit of a mixture. Majority from South, but great to see so many from North Wales as well, and Mid Wales joining us. It's great that these webinars are reaching across the whole country. That's fantastic. Just give it a couple more seconds to get some more votes in. Okay, thank you for taking part. Right, I'm just going to load up the next question for you. I just want to find out a bit more about your career aspirations. So you want to know, are you already thinking about a career in STEM? Fantastic, so many of you already saying yes. Have a couple of no's, which we hope will change your mind by the end of the session. Wow, it's great to see so many of you thinking about STEM already, which is really exciting. I'm sure our guest speakers today will help to keep you motivated and inspired during these very challenging times that we find ourselves in. Okay, a couple more seconds just to get a few more votes. Okay, great. And then we have one final question for you, all about female role models. Do you think it's important to see female role models? An overwhelming 100% say yes, absolutely. You know, if we can't see it, we can't be it, and we need to have those role models out there that we can aspire to be like, and see people like us doing those jobs as well, and know that these jobs are not just for the boys. There's amazing women doing amazing things in the STEM world out there, and we have 4 joining us today. Okay, thank you for taking part in those polls. I'm now going to hand you over to our guest speakers today. And first up, we'll be hearing from Alice Coburn, who's going to be telling us a bit more about the business and a bit more about herself and her career journey as well. So I'm going to hand you over to Alice now. Thank you.
Good afternoon, everyone. I'm hoping you can all see and hear me. And thank you for joining us this afternoon for the Not Just for Boys Pharmaceutical Careers webinar from the ABPI, the Association of the British Pharmaceutical Industry. My name's Alice Coburn, and if we could have the next slide, please, Emma. Our panelists this afternoon will be myself, my colleagues Victoria, Claire and Amelia. So we'll be running through those in that order, and hope that you'll enjoy the discussion this afternoon. So a bit about the ABPI. We represent the pharmaceutical industry in the United Kingdom. And our mission is to make the UK the best place in the world to research, develop and use the medicines of the future. And can we take the next slide, please, Emma? And we do that sort of in 4 main ways: by building a thriving environment for medicine discovery, by improving access to medicines and vaccinations so that everybody in the UK can get all those latest treatments and the most best medicines for them, by enhancing the reputation of the pharmaceutical industry and really maintaining the really high ethical standards that we set ourselves and holding each other to them, and then representing our member companies so that we can really use their expertise in their particular areas to get the best out of everything for the industry. So we do have a really wide spread of members, all the really big pharmaceutical companies you can think of, and then also some really small ones as well. So we have, I think our smallest has 8 employees currently, and then really up to the big multinational corporations. And we can work in really useful collaborations together to get the best out of all the rest of them. And next slide, please, Emma. The pharmaceutical industry in the UK is huge. It's got over 63,000 employees, and about a third of those being in research and development jobs. There's a huge investment into research and development of billions of pounds, making 45 million patient packs of medicines a year. Oh, beg your pardon, a month. I'm underestimating the size of the business. There's 860 sites in the UK within our member companies, and that's across the UK, including various sites in Wales, which we can get into a bit later. And the pharmaceutical industry is one of the most productive sectors, 6 times more productive than average. And if we go into the next slide, I'm happy to talk a bit more about myself. What am I an expert on, if not myself? So my role is in education and outreach, hence why I'm here today. And I get involved with pretty much everything that can be considered education and is relevant to the pharmaceutical industry, from creating animations and diagrams and things that can be used in classrooms to teach across a broad range of the curriculum, pretty much from PSHE to chemistry to we've got a bit of geography today, looking at how antibiotics can be used responsibly in terms of farming. And those are all hosted on our award-winning schools website. We do some coordination work with STEM ambassadors who go into schools and talk a bit more about themselves. And we also engage with employers to look at work experience placements and that kind of thing. I also get involved in responding to education policy documents. So the government asks employers what do they need to make the UK a great place to work. So that's talking about things like immigration policy, or how do we make sure that we can get the right people with the right skills working in the right jobs, and also developing apprenticeship standards so that there are other options if university isn't for you, and you still want to go into routes within the pharmaceutical industry. The apprenticeships route, where you can be paid and learn things at the same time, is really important, really interesting way to do it. We also run a professional exam, so that's for people usually after their degree, if they want to go into medical sales, and that basically makes sure that anyone who is promoting medicine is going to talk to doctors about what different types of medicines do and which ones are best for different uses. Know all of the ethical and behavioural standards that we expect of our representatives, that their information is correct and accurate and not misleading. And I work to make sure that the content for those qualifications is relevant and engaging, and that our delivery of those exams is as exact as possible, so that we can make sure that that qualification really is up to standard. So what I love about my role is that I can get involved in a huge number of different types of projects over the course of the day. I can be talking to examination statisticians one thing in the morning. I could be delivering a webinar at lunchtime, and then later on today I'm talking to a graphic designer about animations and how to create a flash game about evolution for primary school students. So I really love that kind of variety that I get in this role. And next slide, please, Emma. A bit more about how I got here. At school, I really enjoyed all science subjects. I thought they were fascinating. I mean, some of my earliest memories are sitting in my chemistry, helping my chemistry teacher set up for experiments at lunchtime. I was that kind of kid. I found it interesting explaining the world around me. So I took all the science subjects I could. And then when it was time to apply for or to choose GCSEs and then A-levels, I took biology, chemistry, maths and physics. And then I still didn't know which ones of them I liked best, so I applied for university degrees that would allow me to specialise gradually. So I took natural sciences and decided as I went along which courses I found most interesting. And next slide, please, Emma. So I studied natural sciences at Cambridge, and over the course of 3 years, decided that I liked biology, and then within biology, I found infectious diseases quite interesting, so I specialised a bit more in that. And then in my third year, I specialised really heavily into virus research. So I decided that I was going to go and do a PhD in virus research, and I spent 4 years at the University of Glasgow researching very timely how respiratory viruses emerge from China, jump species and spread in the population. So this year has been an interesting one for me. And then I was pretty sure from the age of about 10 that what I really wanted to be was a research scientist. I wanted to be in the lab doing the experiments, and that was what I was going to do forever. Next slide, please, Emma. So I was in the lab, I was working, and then after about a year, I discovered that I was really not enjoying that. If we could click, please, Emma. So discovered that I didn't actually like working in a lab very much. I found that very difficult. I didn't like the environment. So I decided to change and do something completely different. So what I discovered I really liked doing was actually talking about science. I like explaining it. I love science. I find it interesting. I'd quite like everybody else to find it interesting too. So I spent some time working with science festivals, doing science shows, and working with schools in out of Glasgow to try and get people to take more science subjects. Then over the course of a while, I moved into medical writing, as science festivals were a bit of a piece job. You couldn't always make sure that there was going to be work next month. So I did medical writing, which is writing all the information that you need with your medicines. So the patient information packets, writing up the clinical studies so that people can understand the results. And I did a lot of editing, making sure that that was all very understandable, very clearly written. And that all got a bit samey. So working with the same types of information day in, day out. So that led me to apply for this job at the ABPI, where I would get to do some talking about science, some more writing work in the policy areas, and a few more slightly more varied bits and pieces. So there's been a lot of change in where I thought I was going, and I still don't know what's coming next. But it's been a really interesting journey for me. There's always something new to learn and new to get involved with, which I think is perfect for me. So next slide, please, Emma. My top tips for a career in science are: set some goals, think about what you like, what you don't like, what you need and what you want. So I like talking about science. I don't like working in a lab. I need to be in the south of England to be around my family, and I want it to be quite a varied job. So that's what I'm working for in my career. But top tip 2, don't be afraid to rethink it. The only time I've ever actually been sure what I wanted to do, it turned out I was wrong. I don't want to be a research scientist at all. Take the opportunities as you see them. I got into science communication during my PhD as something to have a go at, and it turned out to be something I really loved. So trying new things has always been a good tip for me. And challenge yourself. I mean, once you found something you like, you don't get comfortable. You try new things, you try and learn something new, and never stop learning. And at that point, I'm happy to answer any questions a bit later, but I'll hand over to Victoria next.
Thanks, Alice. Hi, everyone. Hi, I'm Victoria. I'm a Value and Access Policy Manager at the ABPI. Emma, if you go to the next slide, I'll explain a little bit about what that entails. So my role, I work on policy related to access to new medicines, so patients getting access to new medicines. So when a medicine's developed, it needs to obtain a license from regulatory bodies like the Food and Drug Administration in the States or the European Medicines Agency in Europe, which kind of acts as a stamp of approval that the clinical benefits that a medicine offers outweighs the harms and that it can be given to patients. But also what's required is funding for that medicine, or what we call reimbursement. And reimbursement systems are different in each country, but in the UK we have a system that's called health technology assessment, which is essentially a process that determines whether a new medicine is value for money for the NHS. Obviously the NHS has a pot of money to spend on medicines. Unfortunately we don't have an unlimited pot of money. It's a taxed system. We all pay taxes into the system, into a pot of money, so it's not unlimited. So somebody has to make a decision about which medicines can get to patients. In the UK, so in England, the body that does this is called NICE, and there's equivalent bodies in Scotland and Wales as well. And my role is predominantly focused in this part of the process, all the way from horizon scanning activities to understand what new medicines are coming through the pipeline, through to the reimbursement decisions, and then patients actually getting access to those new medicines. So I work with ABPI's members and with organisations like NICE and NHS England on that. One of the key things that ABPI does is we negotiate on behalf of the pharmaceutical industry an agreement with the Department of Health and Social Care and NHS England. This agreement is called the Voluntary Scheme for Branded Medicines Pricing and Access. I realise that's not a snappy title at all, but essentially the agreement is in place to help get new medicines to patients more quickly, and also ensure that the money that the NHS spends on medicines is kept to an agreed level. And a key part of my role is helping the ABPI to negotiate this agreement, which happens every 5 years, and then also in its implementation. So my team also works on any initiatives really that are to do with access to new medicines. So I get to work on some really interesting stuff, and for me, that's one of the things that I really love about my job. I get to work with really, really clever, experienced and inspiring people in ABPI, in our member companies, and also the organisations like NICE and NHS England. So I have a really good umbrella view of what's happening in the industry, and I find that I'm continuously learning, and that for me is something that I find important and something that I look for in a job role. So what I also do though is all industries, as you'll know, they have to be reactive to changes in the environment, and the pharmaceutical industry has specific challenges in this space because we're providing medicines that treat very sick people. And as a trade association, ABPI represents the industry, so we have to keep really on top of things that are changing and that are going to impact our member companies. So EU exit or Brexit, of course, is one of those things. And then the COVID-19 pandemic as well, you know, unforeseen, but lands and creates a massive change in the environment and the way that the NHS has to respond to that. So the ABPI is doing an enormous amount of work to support the government, the NHS and our members at this time. And you can have a look on our website. There's some really good content on there that explains what the pharmaceutical industry is doing at this time. For me personally, a lot of the work that I do has continued. As you can see, we're all working virtually. So a lot of my work involves meetings and bringing people together to discuss things. So we're doing that online using virtual platforms like this. But there's also been a huge shift. So organisations like NICE and NHS England, you know, they're having to necessarily reprioritise some of the work that they're doing to focus on COVID-19. So, you know, they're looking to see what medicines there might be that can help treat patients that have COVID-19. How can we accelerate getting those treatments to patients as quickly as possible? So I'm working to understand the impact of that and also the impact for other new medicines that are in the system that don't treat COVID-19 but treat other very serious conditions, and supporting the efforts to get things back on track with as minimal disruption as possible. And again, for me, this is all really super interesting and current stuff. And I think that's another real positive of a role like this within a trade association, is you just get to be exposed to so much interesting stuff that's really current and relevant. So on to the next slide, please, Emma. I'll tell you a bit about my journey into a STEM career, which started really young, actually, through my love of animals, in particular horses. The one you can see on the slide is my old pony, Twiggy. I loved horses, I loved science, and I wanted to be a vet. That was kind of the only, you know, vet or a doctor were the two kind of career options that I thought were available when I was at school. So I did biology, chemistry and maths for A level, applied, and I didn't get into university to do veterinary science. And this was probably the hardest setback I've had, and right at the very start of my career. So I thought, that's exactly what I want to do. I'm going to go all guns blazing into that. And I didn't get accepted onto a university place to study that. But it also happened at a time when I then thought, okay, I need to open my eyes to what other career possibilities there are in science. And I spoke to lots of really inspirational people that work in different types of careers. And it just really opened my eyes, because I realized that I've always had a bit of a business brain. So I decided, instead of doing veterinary science, to look for a course that combined my love of science with business. And that led me to do a degree at the University of Manchester, who do a degree in biology with business and management. with industrial experience as well. And people often say to me, that's a very weird degree choice, or we've not really heard of that, or oh, that's an odd combination. And to me, I really don't think it is. You know, I love business and I love science, and I wanted to combine the two. So Alice was saying how she worked through and realized that a lab career wasn't for her. I realized that very early on in school, when all of my experiments went to pot. Very easily, I was hopeless in the lab and knew that I didn't want a career in the lab side of things. So that's what led me to kind of look at what types of degrees were out there and to go and do that at the University of Manchester. I think one of the best decisions that I made during my degree was the choice to do a placement year. So in my third year, I rather than finishing my final year, I took a year out and worked at Pfizer in their regulatory team. So Pfizer is a big pharmaceutical company that you might have heard of. Again, this was a bit of a challenge because there weren't many placement opportunities that weren't lab-based, and the university had a lot of links into companies that had lab-based placements, but not so much in the non-lab stuff. And I was kind of thinking, I don't know exactly what the roles look like that aren't in a lab. So I did, again, a lot of research myself and found the opportunity that Pfizer had to go into their regulatory affairs team. And being such a big company, I also took the opportunity whilst I was there to speak to people who worked there. I went and spent a couple of days in different teams, including their marketing team, their quality assurance team. I spent a couple of days shadowing one of their sales representatives, really just to see what it was all about and what their jobs entailed on a day-to-day basis. And it was through that that I realized that actually market access was something that I was really interested in. So this space around evaluating the benefits that medicines can provide and whether they outweigh the additional costs that they're going to incur for the system. And I think this kind of stemmed from my interest in business and economics as well. So I kind of tied these two together and applied for a graduate scheme at a consulting firm called WG Access. And again, this for me, and I, from my own personal experience and from some of my friends who have done this, would really recommend graduate programs if the opportunity arises. Because as well as being a first job, they also gave me the opportunity to have a lot of training in different things, you know, presentation skills, how to use, you know, Microsoft Excel, how to do some basic modeling, all sorts of things that were just really interesting and have stood me in good stead for my career. I had a quick, again decided, oh, I might try something else. So I spent 18 months working at a firm called ABPI Pharma, who buy drugs for clinical trials. So buy drugs from around the world and ship them into clinical trials. And I just didn't enjoy it. So that was my kind of, let's try something a bit different. Didn't really enjoy it. So I went back into the market access space within a pharmaceutical company called Grünenthal that's based, it's a German-based pharmaceutical company, but I worked in their UK office. And it was from that that I then saw the role at the ABPI and thought, actually, I've done a bit looking at just specific medicines that a pharmaceutical company develops, and their portfolio was in the pain space. They've got a lot of pain medications. And I thought, actually, it'd be really interesting to see a bit more broadly what the industry has to offer and how I can support that. So that led me sort of into the role at the ABPI. But my educational journey hasn't stopped. So after my degree program, I took the ABPI exam. I did a number of other short courses, and I'm currently doing a master's in health economics as well. So alongside my role at the ABPI, I'm doing a distance learning course in health economics to get some additional qualifications. And again, I just like to continually learn. I'm a sucker for fortune, really. I'm doing a full-time job and learning on top of it, but I'm really enjoying that. So on the next slide, please, Emma. I've just put some of my top tips. My first one is just to talk to people and have honest conversations. I ask lots of questions. A lot of the questions I ask are probably really stupid questions, but actually sometimes they're things that everyone's thinking but doesn't want to say. So I would always encourage, you know, asking questions and having honest conversations with people. If you can find a mentor or more than one mentor, I have met some really inspirational people, and actually some of the job roles that I've had, the opportunities are presented through people that I've been talking to who have said, oh yeah, I know someone who does this, you know, I'll link you in and you can have a chat with them. So I use LinkedIn quite a lot, and actually it's a good place if you want to, you know, if you know where you want to get to, you can look up people and see what their career paths have been, because it's all documented there on LinkedIn. So I LinkedIn stalk people quite a lot to see kind of what kind of roles they had, which organizations they worked in. And also it gives you the opportunity, if you want, to reach out directly to them through messaging in LinkedIn. And don't be afraid to give things a go. As I say, I got to a stage where I was like, oh, I've only really been in sort of market access space as kind of a proper postgraduate job. Should I try something else? I tried it, I didn't like it. It's not the end of the world. Just, you know, make a decision and try something else. So I think it's always good to give things a go and make sure that you're getting the most you can out of the different jobs that you're doing. Work hard and efficiently. I think that goes without saying. You don't get to places that you want to be if you don't work hard for them. And being efficient is really important as well, because it's really important to have a good work-life balance and to ensure that you're having a good rounded experience and you're not spending all of your time working. So I'm quite an organized person in my social life and my professional life, and I think that's held me in really good stead to be able to work efficiently, be busy in my roles, you know, and really enjoy that, but also be able to enjoy my time outside of work as well. And lastly, be yourself. I think it always shines through when you are yourself. You know, show how you're interested in your subject area. You know, when you're talking to people, ask them, you know, is there things that you suggest that I read, or, you know, websites that have got really useful information on them that I can use? Because I think anything that you can do to read around your subject and show how interested you are is always really good. And I just put a little snapshot there. Anyone who's into equestrian sports, I don't know if any of you are, but Ben Hovde is an eventer, and when I was putting together my slides for this webinar, I just saw this in the morning, and it says the best thing I ever did was believe in me. And it's something that I struggle with, and I still struggle with that a little bit, and sort of really having the self-confidence. But it's really important that you back yourself and you shine through. So that's what I had to say. Again, welcome any questions that you've got for me. Please put them in the chat, and I think I'm handing to Claire.
Great, thank you, Victoria. So hopefully you can all hear me and see me. First of all, thank you, Emma, particularly for the invite to come and speak to you today. And I hope you're all safe and well. These are obviously very challenging times for everybody. And at ABPI, we've also had some challenges trying to sort of work business as usual and adapt to the circumstances. So my name's Claire Machin. I'm Head of International Policy at the ABPI. I've been at the ABPI now for just over 2 years, and my role focuses currently on developing the ABPI's international agenda. Now, if you could go to the next slide, please, I will dig into a little bit what that actually means in practice. You'll probably have noted that the ABPI stands for the Association of the British Pharmaceutical Industry, and a lot of what we do is in fact based on the UK. However, we have two competing dynamics with that. So a number of discussions that happen internationally can affect our companies and the UK market itself. And I think we're all aware of the number 2 issue at the moment, which is Brexit. Because of Brexit, the UK and the UK companies are now trying to re-establish themselves on the international platform, and to be honest, work out where we are in the world. So my role has significantly increased in terms of the scope and the level of work, and it's become super interesting. But what I've tried to do here in this slide is just capture a little bit of the key areas that I work on day to day. So first off, on the policy side, my main focus at the moment is actually working with my member companies to form an industry view on certain issues relating to the UK's trade agenda. And at the moment, the big focus is trade negotiations that are currently going on between the European Union and the UK, as we try, through government and the European Commission, understand what the future relationship will be. In parallel to that, we're also seeing trade negotiations going on with other countries, the US, Australia, Japan, and New Zealand. So in a similar manner, I'm working with my companies to form an industry view on what we would like the UK government to negotiate in those trade agreements. Now, this work is actually very new to the UK government. we haven't had to negotiate trade agreements for over 40 years. The European Commission previously did that for us. And for the ABPI, we also haven't had an international or a trade function before. And also to me, this is the first time I've had to do anything on trade. You'll see in the next slide, my previous role has been around international policy, but this aspect of it is very new. And I think this is one of the key benefits of the role that that I have, and also working in ABPI in general. I think Alice and Victoria both spoke to this, that we have the opportunity to work on a range of issues. Sometimes they are brand new, never done so before. And, you know, we have to take on those challenges and represent our members when speaking to quite senior people and being able to put across a point of view. So that in itself keeps the day job interesting. But it is obviously, I think Victoria put it very well, you need to be able to believe in yourself that you can address these new challenges and do so well. The second area I won't dwell on too much, but oh, sorry, could you, a bit too quick on the slides there. But I do some work around intellectual property, which is basically the framework which protects scientists who create a new innovation to make sure that nobody can take that innovation and essentially copy it. So a lot of that work is, you know, carrying on both at the UK level and actually internationally. And again, I'm not an IP lawyer. I don't have an IP background, but it's something that I took on as part of my role at ABPI. I think the aspect of my role that I enjoy the most, though, is the engagement with external stakeholders. Quite often this is the UK government officials, mainly in Westminster, Department of International Trade, so civil servants there. And what I will do is take those points of view that we've created with our members and go and meet with government officials to try and explain why this is our viewpoint, what benefit these policy changes will make to our membership, and what is the evidence supporting that. I also do have, and I think this is probably the most favourite part of my job, part of my role involves meeting UK stakeholders abroad. So quite often that will be in Geneva, in Brussels and in Washington. So these are people at the UK embassies who represent the UK's, as a country, our interests in discussions with other countries. So they are obviously like to meet with business representatives to understand what the UK business community thinks or challenges we have in a certain country. So by far, as I said, the best part of my job is actually being able to travel to those countries, meet the people, and just understand sort of how the dynamics work when you compare Washington to London to Geneva. I mean, it's fascinating, and it's definitely the best part of the job for me. If you go on to the next slide, please. So a little bit about how I got here. Actually, listening to Alice and Victoria, I think we've followed quite similar paths. So at school, I was also very much focused on the science subjects. In particular, I was really interested in sort of the sports science aspect. And so at A levels, I took biology, chemistry, maths, and PE. I didn't know quite where I wanted to go with it. I knew that I couldn't be a doctor. I have a complete phobia of blood, so that was written out straight away. So trying to find a degree that would allow me to do aspects of sports science was key, and that's the main thing I was looking for. I didn't know quite where that would take me, but for me, it was just having a degree that would interest me, I think, and it would be my number one top tip. You have to get out of bed every day, and this has to be your world for 3 years. So it does need to interest you. And so I actually went to Oxford and I studied human physiology. I think this has now been branded into biomedical sciences, which is a little bit more common terminology. And as part of that degree, I did a bit on sports physiology, but I also did a bit on cell and gene therapy, immunology, So although I wasn't just fully focused on the area that I was interested in, I did get a lot of exposure to other aspects of biomedical sciences, which I think is useful. I think, you don't want to focus down too early, because as Alice said, you might actually find that you change your mind. So then as part of my degree, I did a series of lab placements. I spent a month up in Edinburgh in a research lab. And then I actually spent 6 weeks over the summer period doing my dissertation for my degree. I have to say, I think I echo what Alice and Victoria said. I thought I would like being a lab researcher, but in the end, I discovered it wasn't for me. I just didn't have the patience. The worst thing for me was when an experiment went wrong that you'd been working a week on, and then you had to start again from scratch. It just wasn't for me. So I then graduated in 2010, and I did not have a clue what I wanted to do. So I moved back home, started a job as a waitress for 3 months, and I just fired off job applications left, right, and centre. And I think, to be honest, my biggest mistake was I didn't really think about what I wanted for a job. Looking back, I was applying for marketing roles in retail companies. I was applying for graduate schemes in pharmaceutical companies. I was looking at internships at charities that focused on global health. It wasn't I didn't take a strategic approach and think about it. That being said, I actually secured a job interview with IQVIA, which at the time was a consulting firm called IMS Health. And this company basically has a lot of health data, particularly on the pharmaceutical industry. And the role they were looking for was someone to come in as an analyst and to analyze that data and interpret it, to be able to look at trends that are happening within the pharmaceutical companies and be able to talk to the companies about the trends and the impact it would have on their businesses. Now, this sort of company and role I had no idea existed, but actually, in hindsight, it relied on my science background. It relied on my analytical skills, and I was much stronger in the analytical space than sort of the creative areas. It was versatile, and it was also, I got to meet the companies. I had clients, and you were responsible for delivering to those clients. And I'm very much a starter finisher. If someone gives me a job, I like to be able to finish it, deliver it. Here you go. So for me, this was a great starting point and introduction to the pharmaceutical industry. I would say a couple of years in, I really focused on the pharmaceutical policy side of things. So rather than which companies are selling which drugs and which drugs are selling the most in different countries, it was actually what are governments doing to help shape the market, and what impact does that have on the companies and the industry, was what I found interesting. And so I actually applied for specific roles doing analysis on pharmaceutical policy. And as part of that, I managed to persuade my manager at the time that I didn't have a background in policy. And so would they very kindly fund a master's for me. And so I did a 2-year master's at London School of Economics. I have to say it was very tough. I don't envy Victoria now, having to work full-time and study. It does take a lot of dedication when you've had a tough day, and then you've got to go home and open the books. But it is very worthwhile, and just the people I got to meet, as well as the academic grounding that I received, was well worth it. So after completing the master's, I went back to full-time working at IMS, and actually one of my clients was a company called ABPI. And this is an organisation very similar to the ABPI. It's actually our sister organisation that works in Brussels. So they represent the pharmaceutical industry in Brussels and work with the European Commission. ABPI was my client. I got to know people I was working with really well, and ultimately they seemed happy with what I was doing and offered me a job. The sort of issue here was the job was not based in the UK, it was based in Belgium, so I had a decision to make. I'd always wanted to work abroad. it had been a priority. I have to say, Belgium wasn't where I thought I would end up. I thought it would probably be the US or Australia, but nevertheless, the job offer was in Belgium. So I decided to just go for it. I thought, at this time in my life, I have no dependents, and I should just take this opportunity and run with it. And so I did. I moved to Belgium for 2 years. It was a great experience. However, I think probably 18 months in, I knew that I wasn't going to stay there forever. I wasn't going to settle down in Belgium. So at that point, I did look to relocate back to the UK. And the job from the ABPI came up. And actually, it's a job now that required international experience. So the 2 years I'd had in Belgium working at ABPI was ideal for the job I'm doing now. So that's how I got to my current position. And I think sort of reflecting back on my journey, if we could go to the final slide. Thank you. In terms of my chapters, I mean, I echo everything that Alice and Victoria said beforehand, but for me, throughout my journey to this point, I have pursued what interests me. I think a lot, and I mean, this might be a bit unfair, but quite often people will go for a flashy title or, a job that people understand, a lawyer or a doctor. My job now is actually quite difficult to explain. My parents still don't really understand what I do. However, I've got here because I've made career and academic decisions based on what interests me. I think with that is just, and what I really want to emphasize here is that it is important than any other factor. I have friends who wake up on a Monday morning and they dread getting out of bed, whereas I can quite honestly say I look forward to Monday. It's not only because I've got great colleagues, but it's because I enjoy what I do, and going to work for me is a pleasure. It's not a chore. I think my third and final tip is identify the experiences you want from your career and from your life. For me, I had sort of two main criteria for the jobs that I wanted to do. One is that I wanted the opportunity to live abroad, and two, I wanted to be able to travel with my job. And so that also helped guide the type of job that I would be willing to consider or not. Again, it's not just sort of on those flashy titles. It does your job provide you the whole lifestyle, whether it's where it's based, what you're doing day to day, that you are looking for. So with that, I think I will hand over to Amelia, I think is next. So thank you very much.
Okay, thank you, Claire. Hi, everyone. Good afternoon. Thanks for joining. My name is Amelia Mortas, and I am Examinations Executive at the ABPI, and I sit within the Research, Medical and Innovation team. Emma, if I could have the next slide, please. Thank you. So my role at the ABPI is split into two parts. So 50% of my time is spent supporting the running of the ABPI exam for medical representatives. So I'm a key contact for taking any queries relating to the examination process. I also help Alice in maintaining up-to-date learning materials and in setting the exam papers, and also delivering the exam across different locations within the UK. The other 50% of my time was developed to provide collaborative and cross-functional support for the different directors within research, medical and innovation. And within our team, we have 4 strategic priorities. The first is new medicines and health data. Then we've got regulatory science, quality and safety. Then we've got skills, education and academic collaboration, followed by medical leadership, appropriate prescribing, code and the ethics. So we cover a lot of stuff within that team, but we are mainly focused on science, research, policy and how to make the UK the best place to develop new medicines. So as part of that role, what I tend to get involved in is helping support the organisation of meetings, and they could be meetings bringing in external stakeholders and our members together to just discuss the strategy going forward. And one of the projects that I'm doing at the moment, which is really interesting to me, is looking at how best the pharmaceutical industry can research and develop drugs when, for example, a patient has more than one condition. So that could be, a combination of arthritis and diabetes, but how can we make sure that the research into the different drugs are suitable for people who have maybe more than one condition? I think that's ever important with an aging population. Another project that I've been involved in is looking at academic collaboration. So all the different ways in which the pharmaceutical industry interacts with academia, whether that's different universities or different research institutions. So what I've been doing is collating the number of links between those, which is useful information when speaking to government. If I could have the next slide, please, Emma. Thank you. So how did I get here? Back when I was at school, and I went to school in High Wycombe in England, I went through a lot of different ideas in my head as to what I wanted to be. At one point, I wanted to be a forensic pathologist, then a police officer, and then a pilot, a doctor, lots of different things. And I can never quite make my mind up, and I probably still can't to this day. But I decided to take science because I was always really interested in that, and mathematics. And interestingly, what I was going to do for my A-levels at that point was business studies, psychology, and maths, with an idea of going into marketing at this point. But once I got my GCSE results, I realised I'd done really well in science and I was interested in it. And I phoned up my school a few weeks before and asked to change to biology, chemistry, and maths. And that one decision has shaped the rest of my career to date. Just to say, like, the role models that I had at school, in particular my chemistry teachers, were fantastic, and I went to speak to them about different careers and people that they knew, and I decided that science was an area of interest. And I moved on to the University of Glasgow. I did my undergraduate master's in genetics, and during that time I had a year abroad at the University of Tampere in Finland, where I was involved in a research project, so that was fantastic. It was quite challenging to be away from home at that point, but I think the culture and the environment and learning about a different place was definitely a really useful and building opportunity for myself. I stayed at the University of Glasgow and did a PhD in molecular and cellular biology, focusing on mitochondria, the powerhouses of the cell, and that was really interesting. And I really loved research at the bench side. But I thought I'll try something new after that. And then I moved on to a company called Amici Procurement. So procurement is looking at how you can buy things for a company and at the best price possible. So what I did here was negotiate different reagents, chemicals, lab equipment for these different companies to help keep their costs down so that they can focus on the life-changing research instead of on buying things. But at that point, I realised procurement also wasn't really for me, and I moved on to the ABPI, where I am today. And I really love my role because I get to see a lot of different aspects of science policy and what the ABPI does as an organisation. And I think the most rewarding part for me is being part of an organisation that can have that sort of change and influence in the pharmaceutical industry and represent our members. Could I have the next slide, please, Emma? So 5 top tips from me. Number 1 is celebrate the small wins, no matter how small they seem. You might think that they're insignificant at the time, but those small wins will add up into the bigger picture. And secondly, always ask for help when you need it. Everyone has to start somewhere, and no question is too small. The phrase I like to say is every day is a school day, and if you don't ask questions, you might not be learning anything new. And whatever you choose to do it with determination and passion. And it's okay to change your mind, rethink your plans. As you'll have heard from all of us, our career paths and journeys have gone from one thing to the next and then back again. And, I think it's fantastic to try out different things. And also remember that at any point, it's okay to take a break. Life is full of unexpected challenges and events. And, just because you have to take some time out doesn't mean that you can't go back and start again. But finally, never give up on your goals. That's all from me. Oh, sorry, can I have the next slide, please? I have a few more to talk about. So just to say that within the ABPI education team, we have a dedicated careers site, which you girls might find useful. We've got lots of different case studies of a variety of different roles in industry. know that we've all spoken about ours in terms of education, outreach and policy, but we do cover people from lots of different lab roles as well, and all the other roles in manufacturing, engineering within the pharmaceutical industry. We also have a free-to-use schools website, so this will have lots of resources that yourselves can use or teachers can use, and we try to cover a lot of the current curriculum within the UK, so you might find this useful when studying for your exams. And then next slide, please. And finally, just some links to the different resources and websites that you might find useful. And thank you again, it's been a pleasure speaking to you. And pass back to Emma.
Thank you, everybody. I hope you will all agree at home that those talks are very inspiring and very insightful as well. And the top tips that we've heard today, I'm sure they will help you at home. And I hope that today has been able to showcase a variety of careers, and there were some common themes throughout the talks as well about not being put off by any setbacks, and it's okay to rethink and change direction as well. And it was great to see so many different types of careers that are available within STEM, and that they can take you all across the world as well. So I'm sure they've inspired you today. And also something else that also really stood out for me as well is let your interest guide you with your career choices. So have a really good think of what really interests you and what inspires you, and maybe start mapping out your sort of career journeys and your career paths as well. So we have some time now to take some questions from the audience. We can send around the slides as well, so I'll give you all the links to the references that were mentioned today, and all the links to the websites and so on, and the resources. So we've got some about 5-10 minutes left, so we can ask a few questions from home. So we have one in. If I'll put it to if the whole panel can answer it individually. If we start with Alice, what can you do in high school to improve your resume CV for a STEM career?
Yeah, sure, happy to kick off on that. I think one of the important things is looking at the types of work experience that you can get. Obviously, it's a bit difficult at the moment with all of our member companies. I think most of us are working from home, so it's a bit difficult to have any kind of meaningful engagement with that. But if you can get even a week or a couple of weeks doing any kind of work experience, and just looking at how people work in teams, and what you think you can bring to a team, is really helpful to help you articulate in your CV what you would bring to a job.
Thank you, Alice. Would anybody else like to add to that?
Yeah, I can do.
Okay.
You go ahead first, Victoria.
I was just going to add, don't underestimate the sort of non-academic stuff that you're doing and how important that is. Putting across in your CV and your statements your passion for your subject. That's really important, as well as just the grades that you're achieving.
And I was going to say the exact same thing. I think, Victoria mentioned at the start her love of horses, which sort of set her on the way. For me, it was sport. So combining the academic with other aspects of your life, it will be really genuine and is a good basis to kick things off from.
Thank you. We'll move on to the next question now. Just want to hear from the whole panel, who are your role models? And if you have mentors as well, if you want to mention anything about the mentoring relationship. If we start with Amelia.
Hi, so as I mentioned earlier, I think my earliest role models were my chemistry teachers at high school, and they really inspired me to go on and do some research, but also to think about and bear in mind other careers as well and where they can lead into.
Thank you. Claire, do you want to talk about any role models that you have or any mentors in your life?
Yeah, I mean, I have to say, I think we're quite lucky because actually in the pharma policy space, there's a lot of very successful qualified women. And I know Victoria and I both have one in particular who we worked with. She worked in one of our companies. She was a general manager for the UK. She led the negotiations that Victoria referenced in her presentation. And, she's an example of an extremely bright, successful career lady. she has rode while she was at university. She's got a family. I mean, she juggles all these things and is also really nice and approachable. So I think, and Victoria's nodding away. I think definitely Louise, she won't hear this, but yeah.
Fantastic, thank you. Alice, would you like to add anything to that about any role models in your life or a mentor perhaps?
Yeah, I think in terms of kind of women I look up to, certainly when I was doing my PhD, there was definitely a woman in my lab who took me under her wing, as it were, and I learned a lot from her about having a goal and being a bit more flexible. I've in the past been very target driven. I've got a direction and I'm doing it. But she taught me a lot about how to reassess, and if things aren't going the way you want or you're not enjoying it, that's okay.
Absolutely, absolutely. Victoria, I know you briefly touched upon mentoring during your talk as well. Are there any other role models that really inspired you?
Yeah, so the mentors that I've had, I've met through the jobs that I've been doing. There've been other people in the company, usually in more senior roles, who have just provided that sort of additional support and a sort of safe place to ask the silly questions and just really get their advice on certain things and what opportunities are out there. So I think for me, it's just meet as many people as you can, you know, sit in the canteen with different people. And that just really helps to expand your network. I mean, I also look to sort of non-pharmaceutical mentors, or not necessarily mentors, but inspirational people as well. You know, like who are you interested in? So I'll give one example for me is Emma Watson, stemmed from my love of Harry Potter, but I think she's absolutely inspirational in some of the work that she does, you know, with UNICEF and globally, and she's a great public speaker, something that I was not ever very naturally good at. So yeah, outside of your career space as well, I think you can just really look at inspirational women.
Absolutely, I think it's really important to be growing your own networks and your own support networks as well. And I'm sure there's lots of really great online events and networking events happening. So if anybody knows of any of those virtual events taking place, please let me know and we can pass that information on to the girls taking part today. I have another question through. I think it's based on some common sort of themes coming out of your talk, so it's okay to rethink and change direction. So we have a question around that. Would you say that it is best to go for more than one job and career plan, as opposed to just focusing on one thing? If we start with Victoria.
I think it depends at what stage you're at. I think it's good to have in mind different things that you might want to try. I think if you're applying for jobs, it's good to be focused. If you've done that kind of background research, had a really good think about what it is you think you might want to apply for, then I would put all of your energy into applying for that rather than trying to spread yourself too thin. But I think, as we said, you know, if you get into that kind of role and you're not enjoying it, or there's other aspects that you're missing from your career that you feel that you can get elsewhere, don't be afraid to try something else. But certainly in the early days, you know, you guys, I think most of you are still at school, keep your net wide and just, yeah, try and understand all the different types of things. Hopefully we've given you some insights into some of the different types of roles you can have in pharmaceuticals, but obviously there's loads of other stuff and you won't really know exactly what it entails until you get into it. To be honest, you have to take a little bit of a leap of faith sometimes, but just try and work out, as the girls on the talk today said, like the aspects of things that you like and whether the role can offer you that, be it international travel, be it doing lots of meetings, or be it actually you might just prefer something that is more analytical, or, you know, sitting behind your desk and analysing data and presenting that, or writing it up into reports. It doesn't have to be, you know, we've all got quite externally facing jobs that require us to do a lot of talking and a lot of meeting people, but not everybody likes that. Some people prefer just to do something really skilled, you know, whether it be in a lab or whether it be behind a computer, and just, you know, if that's what you like, then try and find the roles that will meet that requirement.
Absolutely. Claire, would you like to add anything to that?
No, I don't think so. I think Victoria's covered it well, but I think it's sort of just go for it and don't be afraid to change your mind. You know, even if you start something and decide you don't like it, you will have learned skills and along the way. So you'll use those skills in your next steps. So, you know, you will always learn something. So nothing is a failure. and can only benefit you in the future.
Absolutely, and you may even stumble across careers that you haven't even heard of yet or discovered, or or maybe perhaps they don't even exist yet. So yeah, it's definitely to keep an open mind. So I just want to say a big thank you to our panelists today. We are going to wrap things up because I am conscious of time, and the webinar may just throw us out before we wrap up. So I just want to say a massive thank you to everybody that's joined us today and that's asked questions and taken part, and to our panelists as well, to Alice, to Victoria, to Claire and Amelia. Thank you so much for giving your time today. I'm sure you've helped to inspire and motivate a lot of the girls on the webinar today, so thank you very much for taking part. I just want to tell you about an upcoming event that we have. So we have another Not Just for Boys event coming up on the 16th of July with the Royal Mint, and also with Yumna Mohammed from Swansea University as well. So we will be talking to 3 women from Royal Mint about their career journeys into STEM, and also from Yumna as well, how she got into her STEM career at Swansea University. So I will send on details on how you can book onto that as well. So I'm just going to wrap up now and just say thank you so much. Here's my contact details if you need anything. I will send around the slides, and if you have any more questions for us, we can answer those offline and we can send them around as well. And if you want to get in touch with us about helping you to find a mentor, I'm sure we'll be able to help facilitate that as well. So thank you, everybody. Enjoy the rest of your day.